Excellent. What it's amazing background, and through kind of as a data leader in the space, with all those kind of multidimensional um, points of industry experience, what would you say has been kind of most surprising to you along this journey?
Well, what you, I think what has been most surprising is how slow we have adapted. When I did my training in that National Library of Medicine, National Institute of Health back in the late 90s. And of course, already by that point, the insurance industry, airline industries, all major corporations were using data in fairly sophisticated ways. And healthcare was labeled as notoriously behind. We were still using paper and storing it in warehouses and requesting it when a patient came in. And so the ability to do aggregated data analysis and have it in any way, guide your practice was really something that was happening only in a few places that had really significant resources around that. But
Hmm.
once you went to the electronic health record, you would have thought that we would have immediately been able to leverage the data that we were getting. And what I think that surprised me is really how rough the healthcare data model is, how challenging it has been to find even as I said, I've installed most of the leading vendors of health records, and still the data quality, the data issues, the ability to use the data in a way that makes a substantial gain for the industry is still pretty challenging. And we still live in a world where the payers the payers still are doing high level analytics with our data and knowing more about us than we know about ourselves in some situations.